Good day, everyone. I'm Eslagan Bartento, and today we're going to talk about malaria. But first, we're going to have an icebreaker, and I prepared the jumbled words. Then you'll guess it, and it is related to our topic for today. So in this icebreaker, you have 10 seconds to guess the word. So the answer is Annapolis. Next one. The answer is Plasmodium falciparum. Next one. The answer is blood smear. Next one. The answer is artesunate. Next one. The answer is mosquito net. Now that we are done with the icebreaker, let's start our topic for today. But first, what is malaria? Malaria is a disease caused by parasites that are transmitted to people through the bites of infected female Anopheles mosquitoes. Malaria is caused by Plasmodium parasites. So the five species that infect humans are Plasmodium falciparum. So they're the most deadly. Next is the Plasmodium vivax. Next is the Plasmodium ovale. Next is the Plasmodium malaria. And lastly, Plasmodium knowlesi. So what is the mode of transmission of malaria? Malaria is transmitted through the bites of an infected female Anopheles mosquitoes. The mosquito becomes infected by biting a person who has malaria and then transmit the parasites to the other humans through subsequent bites. So, pwede rin po dyan through mosquito bites. So, yun po is vector transmission. Next is pwede rin po siyang blood transfusion and shared needles. And lastly, pwede rin po siya ng congenital transmission. Ibig sabihin po na from mother to baby. So, for the pathogenesis and clinical manifestations. So, once daw po na nasa loob na po ng human body, the Plasmodium parasites travel to the liver where they mature and reproduce. So, after a few days, the mature parasites enter the bloodstream and infect the red blood cells. So, this cycle of red blood cells infections, replications, and rupture leads to the clinical symptoms of malaria. So, lagi po natin tatandaan ng pathogenesis. Yan po is Anopheles mosquito. And then for the clinical manifestation, there are three phases of infection. So, the first one is the acute phase. So, dun po is papasok po yung high fever, chills, and flu-like symptoms. For the second phase po is the complicated malaria phase. Nandyan po yung severe anemia, respiratory distress, and then the multi-organ failure. And lastly, the recovery phase. So, dyan po yung gradual improvements of symptoms. So, for uncomplicated malaria, the signs and symptoms are high fever, chills and sweats, headaches, nausea and vomiting, muscle pain and fatigue, anemia and jaundice. Yun po is due to the destruction of red blood cells, and then enlarged spleen. For the severe malaria, ang signs and symptoms po niya is cerebral malaria. Yun po is brain infection that can lead to seizure and coma. Next is the severe anemia, respiratory distress, and organ failure. So, mag-proceed na po tayo sa laboratory diagnosis. So the first one is the microscopic examination. Diyan po yung blood smear. Dito po is kukunin po yung blood ng patient, then i-examine po siya under a microscope para po tignan ang Plasmodium parasites. So the next one is the rapid diagnostic test. So dito po is dinadetect ang specific malaria antigens in a person's blood. So useful po siya for quick diagnosis but less definitive than microscopy. And lastly, the molecular test. So yan po is yung polymerase chain reaction. Dito po dinadetect ang parasites DNA, then it is highly sensitive and specific. Pero expensive po siya and not commonly used in routine practice. So let's proceed naman po sa treatments. So here are some anti-malarial medications. For uncomplicated malaria, we can use the artemisinin-based combination therapies or ACTs. Next is the chloroquine for chloroquine-sensitive Plasmodium species. So, for severe malaria naman po is nandyan po ang intravenous artesunate. So, ang for quinine naman po is kapag hindi available ang artesunate. Lastly is the supportive care in a hospital setting. Example po nito yung for fluids, blood transfusion, treatments of other complications. Now let's move on to prevention. From preventing these mosquito bites, you can use insect repellent on exposed skin. You can also sleep under insecticide treatment mosquito nets. You can also wear protective clothing, gaya na lang po ng mga long sleeve, pants, mahabang damit, para po maprotektahan tayo from mosquito bites. Then you can also use mosquito screens on windows and doors. Yan madalas po natin nakikita sa mga bahay, mga screen sa pinto, sa bintana. So next is the preventive medication. Sa preventive medication naman po, nandyan po ang chemoprophylaxis. Yan po is taking anti-malarial drugs before, during, and after travel to malaria endemic areas. Now for vector control, nandyan po ang indiresidual spraying with insecticides. Yan po yung madalas natin makita or mapapansin na mga naka-PPE, ini-sprayan po nila yung bawat sulok ng bahay para po maiwasan ang mga insects. Next po nito is larval control measures. Ang mga example po nito is yung pag-alis po or paglinis ng mga tubig na maaaring pagmulan po ng mga mosquitoes. Gaya na lang po ng mga drums na naka-stock natin tubig. Di ba po, minsan naka-stock po na tubig sa drums. Nakikita nyo po kapag tumatagal madumi. Diyan po pwede mag-breed ang mga mosquitoes. Now, for the vaccination naman po, we have the RTS-SAS-01. Yun po is Muscurix. Ito po yung first malaria vaccine. And ito po ay recommended for young children sa mga region po with moderate to high transmission of Plasmodium falciparum. So that ends our discussion for today. So lagi po natin tatandaan ang malaria is a disease caused by parasites that are transmitted to people through the bites of infected female Anopheles mosquitoes. So I hope everyone learned a lot from me and sana po is natulungan ko kayo masagot ang inyong katanungan. Thank you so much everyone for listening po. Once again, I'm Aslag Importanto and have a great day everyone.